When most people think about hospitals, they think about doctors and nurses and people in need of urgent care. But there are places inside many hospitals that people don't normally see. Universities set up research institutes, and private industry often set up joint laboratories in facilities like this. Now, I'm standing in the lobby of the Shanghai Children's Medical Center, one of the top pediatric hospitals in the country, and I'm going to visit one of those laboratories right now. I'm here to see Dr. Liang. Now, she doesn't work here as a medical doctor. She's actually a research scientist with bioMerieux. They've set up a joint laboratory here so they can run tests on a new system for finding markers for instances of AKI, or acute kidney injury. Now, I'm not a doctor, but from what I've read about AKI, or acute kidney injury, is people who undergo heart surgery are particularly susceptible to this condition. Children who are born with congenital heart disease and undergo surgery are particularly susceptible to AKI. Now, I got a lot of questions, so let's head inside and talk to the expert.
Hi, Steve. Nice to meet you.
Nice to meet you.
Okay, please.
Excellent. So we're going into the lab, are we?
Yes.
What exactly is the percentage of AKI occurrence?
Studies reported that AKI can occur in up to 40 to 50%
Almost
of
half.
Infants or children who are undergoing complex cardiac surgery. Early recognition and management of AKI is important to prevent further renal damage and therefore improve patient outcomes.
Right. So what is the current method available to hospitals to test for AKI?
The traditional diagnostic methods for AKI relies on changes in serum creatinine and the urine output. But these methods are non-specific, and they may also have a delay in detection time.
And this is what makes your system superior?
Yes. So in our collaborative study with SMC, we found our new urinary biomarker detection kit, the NephroCheck, can predict the occurrence of AKI as early as 2 hours after the initiation of CPB. Maybe just immediately after the surgery, the patient with high risk of severe AKI can be detected.
What is the status quo of your experiment? How will these findings be applied here in China and around the world?
This study we launched at SMC actually is the first clinical study of NephroCheck in Chinese children. And before our study, there was limited research on these new biomarker in pediatric patients. So last year, our research work has been published in Pediatric Nephrology, which is the official journal of the International Pediatric Nephrology Association. The NephroCheck kit is currently in the process of registration, and I think our results combined with others can finally contribute to its registration in China.
Take that stuff out.
Where the sample located, and we could put this here.
The hospital provides you with these samples, right?
Yeah. So the reagent, the strip.
This is the reagent strip going in?
The research work at SMC joint unit is not only just for the Chinese market, but rather it's geared towards the global market. In the US and Europe, this NephroCheck kit has been approved for use in patients older than 21. However, it's not commonly used in pediatric patients. So we just hope our research work, our results can support the use of this kit in pediatric indications.
Outside every one of bioMerieux's major campuses are one of these, an installation, a sculpture of a horse. And this is very, very symbolic. Now, interestingly enough, the word vaccine actually comes from the Latin term for the cowpox virus. But the founding father of this company decided to take his antibodies from horses instead of cows. I guess he decided they were a better partner, and that's why outside every one of the major campuses, you'll find one of these statues. This is, phenomenal. So, Mr. Chen, why did bioMerieux decide to set up its R&D facility here in Shanghai?
bioMerieux is a 100 years old company, and in the recent decades, we are really leading the infectious state diagnostic in the worldwide. We are the only company outside USA and outside Europe have the manufacturing facility here. That means somehow we need to really have a very strong backup of the R&D activities in order really to produce the products to answer the needs of the markets. There are many leading medical universities here, and also leading medical developments in Shanghai. So all the talents available here provides very strong backbone for the R&D activities.
And what are the future plans for bioMerieux in China and in Shanghai specifically?
Just very recently, we decided to expand our manufacturing capacity here. And again, aligned with the manufacturing capacities, we need to have a stronger, more extensive R&D activity here. And I think lastly is really how to improve the efficiency of our diagnostics in the hospitals. It's where we'll spend efforts in the R&D, so hopefully we are able to have a more integrated solutions offer to the hospital and really improving their efficiency in the diagnostics.